We all are connected with women in our life. I am myself a woman. Many women are sitting here, and we are always surrounded by women because we see them as our mothers, grandmoms, as our sisters, friends. But do we ever realize that there are some problems which many women are suffering from and they are too ashamed or shy to speak about? Yes, there are many such problems which women do not know whom to contact and whom to talk to. And that is what we are going to talk in this brief talk today. We are going to cover some unspoken problems with which many women suffer. Let's first listen to a story of three women. Miss A, she is for 22 years old. She has just finished her graduation and has got a very good job. She is on cloud nine. She is having such a beautiful life, spending time with friends, moving in and out of relationships, and enjoying her evenings very nicely. But suddenly her life comes to a standstill. What has happened? The evening sundowners are now replaced by her regular visits to the gynecological clinic. She is suffering from recurrent or repeated vaginal infections. She takes some treatment, she is fine, but again it recurs. Again, she goes to a doctor, takes some treatment, tries some naturopathies. Again, the problem is just not going. And it becomes so much that she thinks that now she is in no position to go to the parties and she just hates being in the relationship because the normal sexual life is affecting. She gets very painful intercourse, repeated infections, and then she is very troubled with that. So is there nothing available to help such women? We'll come back to her. Now is a story of Mrs. B. Mrs. B is 35 years old, very nice young woman, blessed with two lovely children, and the younger kid is now around 3 years of age, and she is saying, thank God, now my life is coming back to normal, the sleepless nights have reduced, and I can just now think of something about myself and can have some more romantic moments with my husband and my me time. She plans her anniversary dinner, and then the same night, all her dreams come crashing. Why? Because she realizes that her body has changed totally after the pregnancy and childbirth. She is not able to enjoy those intimate moments. She does not have any feelings, and her vagina feels very loose. And also, at times when she is having intercourse, she is leaking urine or some gas through her intimate parts. She goes to a doctor and doctor says, welcome to the motherhood. This is the price a woman pays for having a child. Many women, they suffer from this problem. So is there nothing we can do to help her? We leave her here, we'll come back to her. Now comes the story of Mrs. C. Mrs. C is now 75 years old, had a very nice life. She was very active, had a professional life. Now she is retired, good financial support, good children, many grandchildren. She was a social bee, but now we don't see her. Why is it that we are not able to see her? Because she is confined, unfortunately, to her house. Why is she not coming out? There is no problem. The problem is that she is so scared of coming out because she feels that if she goes out, she coughs, sneezes, or is having a nice smile or laugh with a friend, she may just leak urine. This is known as unwanted urinary leakage or stress urinary incontinence. The studies have shown that longevity of life is increasing. We all know that now if we live a healthy life, a person is supposed to live around 80, 90 years if nothing unexpected happens. And in a woman, the menopause, when the estrogen levels they fall, that is around 45 to 55 years of age. Now, estrogen is required not only for the beauty of a woman, but it is required for her brain health, for her bone health, her vaginal health, urinary health, and for so many purposes. So is she paying a price for longevity? 1 in 4 women over the age of 18, they suffer from urinary leakage. So what is urinary incontinence? According to WHO, World Health Organization, the urinary incontinence is involuntary loss of urine on coughing, sneezing, or any activity where you put pressure on your bladder. And the prevalence and incidence of it increases sharply with the age. This is a very common posture of women you might have observed when you are in public. And what is this patient, this woman trying to do? She's just trying to hold her urine because there might not be a facility of washroom nearby, or she's very scared that if she coughs or laughs, she may leak urine. So, what can help all these women? The the good news is the technology. Technology has revolutionized our lives in many ways and also in the healthcare. So now lots of things are available with higher technology where these women could be helped. Earlier, the only solution was either for urinary leakage, there would be a surgery, or for other problems which Mrs. B and Miss A were suffering, there were usually no treatments for that. So now what all we have lots of non-surgical options for treatment of SUI. And what are these options? These options are laser, high intensity focused electromagnetic vibrations, platelet-rich plasma, high intensity focused ultrasound, carbon dioxide in form of carboxytherapy, and radio frequencies. So what is laser? Laser is a very powerful tool. If used properly, it can lead to lots of constructive things, and if used in a bad way, we all know it can lead to a lot of destruction. So in medical world, the laser has really come as a boon. So laser are the targeted fine molecules which come in a stimulated emission of radiations, which we say. So these molecules or microatoms can be targeted on the desired area, and regeneration of that area can take place. So laser can be targeted and it can lead to collagen and elastin remodeling. Aging, how does aging happens? Anywhere on our face, on our body, there are elastin and collagen cells. And these elastin cells, they are just like tight ropes. If you see the face of a little baby and a face of a 70 years old, what is the difference? They're sagging. So under the skin, there are tight rope-like elastin fibers which keep it tight and taut. So these elastin and collagen fibers, they get degenerated with the age. So laser works on these fibers and leads to its regeneration. So the modeling takes place in different phases. There are 3 phases in which modeling takes place. So most of these devices, they require 3 to 5 sittings, either 2 weeks to 1 month apart for your parts to get regenerated. So this laser beam is directed towards the vagina. It is through special devices, it can be inserted in the vagina and the targeted organ can get regenerated and vaginal mucosa gets regenerated and infections get cured. So what is the advantage of these technologies? The advantage is they are non-invasive procedure. They are totally painless. There is no surgery, no cut, and they are coffee break procedures. The women are working nowadays, they do not have time, so they can just come in their lunchtime and get this procedure done, totally painless. It leads to vaginal rejuvenation, it helps in urethral rejuvenation, and the infections, they go away after treatment. If you give laser, then the vaginal wall gets regenerated and recurrent infections, they go away. In older women or the women who are having urinary incontinence, the urethral wall gets the support and vaginal mucosa, it provides supports to the urethra, and as a result, the urinary leakage, it goes away. And there is no downtime. These procedures, we have to understand, is nothing permanent because aging is not permanent. So if these, without any pain and without any time consumption, if you are problem free, so after 1.5 years, if the problem comes again, you can just go and take a memory sitting. Now you're looking at a very beautiful chair which is uses the HIFIM technology. It is high intensity focused electromagnetic vibrations. You just have to come and sit on these chairs and they give high focused electromagnetic vibrations to your pelvic areas, and it causes supramaximal contractions of your pelvic muscles. So many women who suffer from loose vagina or the prolapse, means the uterus is coming down, in those cases, these HIFIM technology, it causes the tightening of the pelvic muscles and these problems can get rid of. So benefit of a chair is just a chair. It's not a surgery. You don't have to go to any operation theater or any hospital, and you just sit on it and they give 11,000 equivalent Kegel exercises vibration. It is FDA approved. You remain fully clothed and you are cured. How magical is that? Now what am I looking at? We are looking at the golden elixir of life. It is called platelet rich plasma. We all are carrying it. It is in our blood. So nowadays the yellow gold is actually platelet rich plasma because we all want to live long, we all want to look young and avoid aging, and there's nothing wrong in it, right? So Platelet-rich plasma is prepared from their own blood. 10 to 15 cc of blood is taken, and from where the platelet concentrates are got, and they are specially processed, and platelet-rich plasma is prepared, which is full of growth factors, and this is injected in the targeted area, be it the face or in the our women who are suffering from those problems. We inject them in the vagina and suburethral, and this helps in them in getting relief from these problems of unwanted urinary leakage, vaginal dryness, vaginal stiffness, and pain during intercourse. Stem cell therapy is also nowadays coming, which is also used in the same way. Stem cells are anti-apoptotic and anti-inflammatory cells, and they are again prepared from your own body tissues, and they can be injected for rejuvenation. So benefit of PRP is it's your own blood, it's hygienic, there are no side effects, you do not react to it, and the effects are long lasting. So now we can go back to these women and we can tell them that there is a treatment available. In fact, you can look around in your own society. You may be you may fit into one of these 3 women, or you may be having them in your home. You can go and ask your moms, your grandmoms, your sisters, your friends. If they are suffering, they just have to go to the clinics and get their treatment done. And then you can tell them they should walk their life confidently, do not suffer in silence, be confident, and be like a diva as long as you live. Thank you so much.